Hi, Dr. Arlen Albur here from Orthopedic and Balance Therapy. In today's video, we're going to talk about the top two most common causes of heel and foot pain. Number one is plantar fasciitis, and the second one is Achilles tendonitis. So what is plantar fasciitis? Plantar fasciitis is the inflammation of the plantar fascia. But where is the plantar fascia? So let's go ahead and zoom into our foot. And the plantar fascia is actually located at the bottom of our foot. And there is your plantar fascia. As you can see, the plantar fascia originates from the bottom of the heel and spans the entire bottom surface of our foot all the way to our toes. So how do you know if you have plantar fasciitis? So typically you will experience a stabbing pain, usually right around here on the underside of the heel, more on the inside of the underside of the bottom of the heel. Patients with plantar fasciitis would also tend to complain of a sensation of tightness or tenderness along their arch right here. And symptoms are worse in the morning when taking those first few steps out of bed, beginning of the day, and also at the end of the day after standing or walking for a prolonged period of time. Also, patients complain of pain when walking barefoot or when they're wearing shoes with poor support. Now, who are prone to developing plantar fasciitis? And usually most common in people over the age of 40. And one of the most common causes is decreased calf muscle flexibility and also fallen arches. Now, the other cause is Achilles tendonitis. So from the name itself, Achilles tendonitis is inflammation of the Achilles tendon. Where is the Achilles tendon? Let me show you guys that. Let me bring this. So the Achilles tendon is situated at the back, in the back of your calf. It's actually, you have your calf muscles. You have two calf muscles, your gastrocnemius, and right behind it is the soleus. Those are your two calf muscles. That's why when we're stretching the calf, we need to stretch the gastrocnemius and the soleus, and they're two different stretches. But the gastrocnemius and the soleus, they both taper down together to form your Achilles tendon or your calcaneal tendon. So Achilles tendonitis is inflammation of the Achilles tendon. How do you know if you have Achilles tendonitis? You'll have tenderness in the back of the heel, usually right around here, the back of the heel, and sometimes about 2 to 3 inches up your Achilles tendon. You'll also experience some tightness in the ankle, feeling of tightness in the calf. In acute cases, you might even have swelling in the back of the ankle. And obviously, you'll have pain in the back of the heel. Who are prone to developing Achilles tendonitis or Achilles injury? It's actually most common in males. And Achilles injuries, the ones that happen in younger males, are usually in the acute type where they severely strain or sometimes even rupture their Achilles tendon. Now, for older folks who develop Achilles tendonitis, it's usually that of the chronic type, where it's due to repetitive irritation of the Achilles tendon. Okay, in our next video, we're going to talk about the top 10 most common questions about plantar fasciitis. I will see you then.